Tonight, a sharp spike in the number of communities at high risk for coronavirus in Massachusetts. 77 cities and towns across the state are now in the red. That's up 22 in just the past week. And tonight, health experts are concerned about where the new cases are surging. Good evening, everybody. I'm Paula Eben. The increase comes as more people are getting vaccinated. Kristina Rex is in Billerica, one of the towns now considered high risk for the virus.
The red zones on this week's state map show clear infection clusters. For example, here in the town of Billerica, it moved from the yellow to the red zone this week, and so did neighboring Chelmsford. An infectious disease expert we spoke to says that's concerning.
We need to keep a very close eye on those clusters. Those red areas do worry me.
Especially because COVID-19 variants are on the rise in Massachusetts and are contributing to infection hotspots popping up across the state.
Thank you.
The town of Billerica is one of more than 20 communities that slipped into the COVID red zone this week.
We did so well. We got into the red. We came back out into the yellow and now back into the red again. So it's disappointing, I think is the word.
Here in the town common, groups are campaigning for an election this weekend, hoping those who didn't vote early still show up to the polls with increasing COVID cases.
I'm hoping that it doesn't deter people from coming out, knowing that the town is providing a safe environment in which to do it.
Many downtown are puzzled by the spike in cases.
As many of us are getting shots as possible. I honestly don't know why that is.
And I actually just got my second vaccine today.
In fact, 500,000 people got a shot this week in the state. And so far, 5 million shots have landed in Massachusetts, and 1.6 million people are fully vaccinated.
The concern I have is that hospitalizations are up 20% in the last 2 weeks. That shouldn't be happening if high-risk people are truly protected.
While cases and hospitalizations are on the rise, death rates have stayed the same. And Mass General's Dr. Mark Seidner says we'll know in a couple more weeks if there's cause for concern.
And I think you're seeing the medical and the epidemiologic community holding its breath and asking the question, have we opened up too fast? Or is vaccination catching up as fast as we need it to? And time will tell.
And Dr. Seidner says while the state naturally reopens the economy, in our private lives, we should still focus on the pandemic, limit our social interaction, and wear masks. In Billerica, Kristina Rex, WBZ News.